Once again, reopenings took place before the numbers got to where they needed to be. And bit by bit, we've seen every indicator yet again move in the wrong direction. No one day-to-day change has been dramatic, but if you look at the trends, they're alarming and they're deadly.
The head of Harris County, which includes the city of Houston, warning residents about the spread of COVID. That county sent out a text message to its nearly 5 million people this week, urging them to avoid socializing and holiday gatherings this year, as that will spread the virus further. Texas already has more than 1.1 million cases. And as you can see from this chart, they are trending in the wrong direction, like so many cities and states in this country. In Harris County, the daily case count has soared by 250% in the past couple of months, and the positivity rate is also rising fast. Now, back in July, when the last wave hit, hospitals in the Houston area reached the breaking point. The patient counts are on the rise now, and the health officials concerned. But so far, the medical centers are handling the rush. So let's bring in our guest, Dr. David Persse, the health authority for the Houston Health Department. Doctor, thank you for the time. I appreciate it.
Oh, thank you for having me.
Well, I've spoken to so many folks from so many different parts of the country, and there seems to be a common refrain. They're concerned where the numbers are going. They're particularly concerned where they're going to be 2 weeks from Thanksgiving. Do I have it about right for you as well? We know people are going to get together. We can give all the warnings we want. But the mitigation is going to go down. They're going to be with family. Kids are coming home from college also. It adds up to a really troubling equation.
Yeah, as the judge said, the clip you just showed, that the numbers are moving in the wrong direction. Here in the Houston area, we're a little bit fortunate in that our numbers are not trending quite as steeply. The graph isn't quite as steep, but it's absolutely the numbers are running in the wrong direction. This may be the Halloween effect, but if that's the case, then as Thanksgiving comes, we can only expect it to, to increase. Now, that being said, I want to remind people that as individuals, we can change the direction of this curve. We've done it twice before. So all is not lost. We just need to get serious about slowing down this virus.
How are the hospitals doing in terms of the capacity and preparation for the surge? One of the things that I know we saw in New York was the unbelievable generosity from so many other parts of this country in March and April. People came in to help. The problem many people see this time is there's problems everywhere. The cavalry can't come. Are the hospitals ready for the numbers, especially if they're on the high end?
So fortunately here in Texas, we've got a pretty robust network of being able to move patients across the state. And this really comes from our experience with hurricanes and flooding. And you may recall that way back during Tropical Storm Allison, we lost 5 of our largest Houston hospitals all in the same night. And we were able to manage moving patients all over. Now, that was different because that was just the Houston area. So right now, we're seeing a lot of patients are being moved out of El Paso, predominantly into the San Antonio market, but also some have come here to Houston. So we have that infrastructure to be able to move patients back and forth across the state. Now, you don't want to do that. That's not great for patient care, pulling people away from their families. And if the whole state is under the same pressure at the same time, then you don't have the ability. But as long as one area of the state is doing better than another, we can start to balance that load a little bit. But we don't know exactly what's coming. We may get to the situation where all of Texas is going to be in a bad situation all at the same time, and that would be extremely difficult to manage.
Obviously, a lot of directives come from the state, not the city or the county for that matter. Is there additional actions for mitigation purposes that you'd like to see come out of Austin right now that would help you guys in addition to calling on people for good behavior? Is there any additional leadership you'd love to see coming from the state that would help you guys on the ground?
You know, Texas is a huge state. I mean, it's geographically large. We've got tremendous economic diversity across the state. We've got a lot of, racial and ethnic diversity. And we've also got a lot of variation of the density of the population, right? We've got big urban centers. We've got rural. We've got frontier. And so a one-size-fits-all solution doesn't really fit well to a state as big and diverse as Texas. So I wish that the state would allow the local leaders, the county judges and the mayors of the big cities, a little bit more flexibility and be able to determine what needs to be done at the local level. Remember, it's I'm also the EMS director for here in Houston, and that's out of the Houston Fire Department. My colleagues in the fire department, they sort of jokingly say it's easier to put out a fire when it's small. And that applies here. So it's easier to slow down a viral outbreak when it's small. If we wait till it gets to be so big that the state has to come in and, close down the entire economy, that means we have a huge problem. And theoretically, with more aggressive, earlier, more micro-centered interventions, we may be able to prevent us from getting there. But that's going to allow the locals to have the authority to do those things.
Just a few minutes ago, I spoke with former Secretary Sebelius, the HHS Secretary, and she was laying out some of the logistics they're going to go into, thankfully, with these great vaccines that are coming forward. But you have multiple pharmaceutical companies. Not all vaccines are the same in terms of the administration and then also how they'll be stored, things you know much more than I do, Doctor. But is the coordination of that going to be really tricky? And how much ramp-up time are you guys going to need so that you can distribute it to the right people in the right priority in the right way?
You're right. It is going to be a big lift. We've been working on it in anticipation. And so really, as I look forward, the biggest concern that I have is not getting the vaccine in and getting it to places where it can be distributed to people. My concern is that so many of these vaccines require 2 doses. I am fearful of the people who get their first dose of vaccine A and then try to get their second dose from vaccine B because they're not paying attention that they need to get the sequence of vaccine A for both their first and second shot. I fearful that that is going to be where we may have put a lot of extra effort into avoiding confusion. But in terms of getting it here, storing it, getting it distributed to folks, the rate of delivery of the vaccine is not going to, we're not going to get it all here at once. And so oddly enough, that's going to actually help with us getting it out to the right people quickly.
And finally, obviously, this is going to be your life here. It's finally we got the vaccine, or we will have the vaccine. You guys will figure out on the ground the logistics with the federal government. But then you got to get people to take it. And given the anti-science and anti-medicine strain that's gone through, and the anti-vaxxers that were even here before we've even heard of COVID, what do you want to see happen so that as a country, this only works if we all, or the vast majority of us, take this, that we can at least rally behind at least this together and this doesn't turn into some partisan fight?
You're so right. Look, we've got to stop politicizing these biologic events, and that's what this is. This is a huge biologic event. It's a public health disaster. It is not a political event. And by politicizing it, I'm really amazed at how some people have adhered to their political beliefs above the staggeringly obvious truth that the virus is real, that the pandemic is real, and that people are really dying from it. And so we have to get past that. We have to get the politics out of it. We have to come together as a community and work on it. When I was a kid, I can remember my grandmother being really upset when I got measles. And she wasn't so upset that I got it. She was upset that it was spreading through the community and that people hadn't done their job. And my grandmother was not only worried about me, she was worried about all the kids in the neighborhood. And so one of the things that needs to happen is we need to stop worrying just about me and my kids. We need to start worrying about our neighborhoods and our communities as a whole and get past all this baloney that the vaccine is going to cause all kinds of problems. It's not causing.
It's the most patriotic thing people can do at this point here. Hopefully we can at least agree on that. But you're going to have a challenging few months. You've already had it behind you. You got it ahead of you. And Doctor, I wish you and all your folks the best of luck. Thank you.
Appreciate it. Thank you very much.
All right, folks, when we come back, Rudy Giuliani's court appearance in Pennsylvania was a disaster by all accounts. After the break, the attorney who argued against Rudy in that courtroom, he'll join us to discuss the incomprehensible case Giuliani was trying to make and also the dangers of that rhetoric.